We're here at the Markkula Center for Applied Ethics at Santa Clara University. I'm Kirk Hanson, the Executive Director of the Markkula Center, and with me is Dr. Margaret McLean, who has done work on the ethics of pandemic flu and dealing with pandemics from a governmental and health point of view. I will ask Dr. McLean a couple of questions about the current swine flu issue and developments from Mexico and in the southern states of the United States. Dr. McLean, 2 years ago, you did a study for the county of Santa Clara on the ethics of dealing with pandemics. What did you find in your study for them?
Well, we were looking at the response to potential avian influenza pandemic here in the county under a mass medical casualty plan. And the thought was that one needs not only to address the public health and medical issues, but also the ethical issues. So I spent some time looking at what is the ethical risk in our response to pandemic flu. And the first kind of principle that came out of that study was that being prepared for a pandemic is ethically mandated. And being prepared in a sense not only of medical preparedness and public health preparedness, but also the ability to manage ethical risk.
In the current swine flu development of the last couple of days, are there ethical issues in dealing with this swine flu development that are important?
There are some current ethical issues, and there will be ethical issues that may come upon us as the story and the infectivity develops. And so, the first set of issues one thinks about now are mostly in terms of the ethics of communication. How is the pandemic being communicated to the public? Who are the spokespersons? What kind of information is being given? Is it sensationalized? Is it accurate? And so right now the concern is for the media and their presentation of the information, and then also for the government spokespersons who are the kind of public face of the Centers for Disease Control and the public face of Washington in terms of the American response.
Did Janet Napolitano get it right yesterday in her announcement of a public health emergency?
I think she did. I think she was measured and appropriate to, the stage of development that we were at that time.
Mm-hmm. Are there ethical issues around how the authorities decide to close schools or keep them open or screen everyone who comes back on a plane from Mexico? There were these images of people with the masks on getting off the planes from Mexico.
There certainly are ethical issues there for a country, a citizenry who values autonomy and our ability to make our own decisions. Any limiting mandates become huge concerns for ethics. Mm-hmm. And one wants to have a measured response that protects the community without overly burdening the individual.
So closing down the crowd for a soccer game might be harder in the United States with our ethics than it would be in Mexico with its ethical culture, which perhaps doesn't emphasize liberty and freedom as much as ours does?
Possibly.
Okay. Now, suppose the pandemic developed broadly and we had many more cases in the United States. Would there be issues around triage, who gets treated, how we would allocate the Tamiflu or the respirators or other things? How would that be dealt with, and is that an ethical issue?
Certainly, if there are large numbers of people who are affected and large numbers of people who are trying to access the healthcare system, triage decisions would become prominent. You have to remember that we already have a healthcare system in which most beds in most hospitals are currently occupied. And that's without, a major influx of patients that could happen should the flu really get a stronghold in any given community or in a country. And so then your list of ethical concerns really gets, the ethical concern that gets highlighted are triage decisions, the decisions about who gets treated, how they get treated, and what principles are you going to use for making those decisions.
Does that change in the time of a pandemic? We normally treat the person who's sickest or the person who can benefit most from the treatment. Are those principles going to be held as important by the CDC or other authorities in the United States if we have a full-blown pandemic?
Well, the CDC in 2007 issued a report about ethical and medical preparedness for pandemic flu. And in that report, they suggested that we actually change those triage criteria. So now if you are, taken into the emergency room, they're going to look at primarily at the two criteria that you mentioned, and that is, if they have to make choices because they have more patients than they have beds, they're going to try to, treat the person who can benefit the most, and the person who is in fact at the most risk. The CDC, when they were starting to talk about pandemic flu, said that those principles were inadequate. And the reason that those principles are inadequate is that the goal in the standard ER is to be able to treat most efficiently the patients who are in the ER at the moment. The goal for the CDC in terms of pandemic flu was preservation for society, not necessarily maximizing the number of people saved, not necessarily the treating those who are the sickest first. Their goal was to preserve society. So the primary criteria that they have suggested about triage decisions is one that in other circumstances would not be used, and that is the criteria of social worth.
So under social worth, who gets treated first? What are the priorities?
The decision-making about quote-unquote social worth would be done on a community level, and the principle under which one would determine social worth is based on an individual's ability to contribute to the preservation of society. So the CDC did not offer a kind of list of persons, but it's suggestive that those who are involved in law enforcement, those who are involved in sanitation, those who are involved in health and the direct administration of healthcare, physicians and nurses, would be among the people who would receive priority in terms of preventive measures, in terms of access to the healthcare system should they become ill themselves.
So the police and the fire, the physicians and the nurses, the sanitation workers and sanitation truck drivers, and others who keep society functioning would get priority.
Yes.
All right. Thank you very much. This is the Markkula Center for Applied Ethics at Santa Clara University.